Hi, I'm Dr. Norman Roth. One of the more common discussions I have with patients is regarding initiating statin therapy. Due to their well-known cardiovascular benefits, statins are one of the most widely prescribed classes of medications. Some patients know that statins lower LDL or bad cholesterol. LDL cholesterol promotes the formation of plaque or cholesterol buildup inside of the arteries. By lowering LDL cholesterol, statins can improve cardiovascular outcomes, reduce your risk of cardiovascular events, and prevent cardiovascular death. Statins also lower triglycerides, which is another form of fat in the bloodstream. Triglycerides are also associated with cardiovascular disease. A common question I get, however, is patients ask me why I want to start them on a statin even though their cholesterol is normal or near normal. That comes from the fact that cholesterol levels are only one component of the overall cardiovascular risk. Men are more likely to have cardiovascular disease at an earlier age than women. However, by the 7th decade of life, the risk of cardiovascular disease is nearly equal between the sexes. Other risk factors for heart disease include increasing age, high blood pressure, low HDL or good cholesterol, obesity, a diet rich in meat, trans fat, high glycemic index foods or low in fiber, sedentary lifestyle, systemic inflammatory or autoimmune conditions, chronic kidney disease, family history of premature atherosclerosis, and cigarette smoking, to name a few. The reason that we prescribe these medications in these settings is that statins have other positive effects. In addition to promoting the normal function of the cells lining our blood vessels, they reduce intravascular inflammation, which is an important process in atherogenesis or plaque formation. And if you have a plaque that's already been deposited, statins stabilize that plaque and prevent rupture, which is the process that leads to heart attack and stroke. Understandably, many patients are concerned about the side effects of statins. Muscle side effects are the most common, but fortunately, severe muscle injury is very rare. Often with mild muscle pains or myalgias, reducing the dose of the dosing interval can help relieve the symptoms. If even that doesn't work, we can stop the medication, and there's other options that we have, but fortunately this is not a long-term problem in most cases. Benign liver enzyme elevations are another potential side effect, but more severe liver injury is fortunately very rare. There's never been any definitive studies that have shown an impact on behavior or cognition, which some people have been worried about over the years, but again, there's no medical literature that has ever proven that relationship. There's abundance of medical literature to support the efficacy and safety of statin use in patients for prevention of cardiovascular disease and with established cardiovascular disease. When combined with a heart-healthy diet and routine exercise, it maximizes your chance of preventing a future cardiovascular event, and these medications have truly changed the field of cardiovascular medicine.